It was the annual mammogram. And the next day, I received that call that no one wants to get, and that is, we need you to come back.
In 2014, I had my yearly mammogram screening at the Women's Center. And next day, I received a phone call saying that they would like to redo the screening.
Because we've, been marvelously fortunate with health, it was really kind of one of those, takes your breath away. And that was just the first step, right?
Went down, had my second one. 2 days or so later, I received a phone call saying they would like me to have an ultrasound. At that point, my mind started thinking, wow, this is a little bit out of the norm.
The women that do get called back are the ones that go through an incredibly difficult period in this whole process. When she gets a letter in the mail, or when she gets that phone call that says, we found an abnormality on your mammogram, her whole world changes.
Upon having the ultrasound, a couple days later, I was informed that it would be in my best interest to contact a general surgeon to have a guided biopsy. At that time, things started going through my mind.
The time frame that it takes, the thought processes that go on in a woman's brain, I can only imagine the anxiety associated with that as she's trying to navigate this whole process by herself.
We've been clamoring in the Cancer Center here at St. Helena Hospital for 5 years, really since the Cancer Center started, about the need that this community has for improvements in breast cancer health and breast cancer detection. And we're really excited about the fact that this gala is going to fund this project, bringing us up to date with all the technology that's required to help screen women for breast cancer and then manage those women who are found to have abnormal screening studies.
The new center is going to have state-of-the-art radiology there, where we're not only offering a 2D mammography, but more improved technology with the tomosynthesis or 3D mammography.
The patient will see this arm move across in front of her. She will be in a position as she normally would be for a 2D mammogram. The science and really the magic behind 3D mammography is that it goes layer by layer and in essence removes layers of normal tissue, and it really then exposes the cancer that's hidden behind that dense tissue.
And our goal is to proceed with additional imaging on that same day. So a woman won't have to leave, go home, wait a few days to hear the results, and then come back if additional imaging or testing is needed.
Depending on what we see, we may then take her immediately to ultrasound. And if we identify something of concern, if it's convenient for the patient, we will perform the biopsy the same day.
We would like to shorten the time between a woman having an abnormal mammogram to the time when a biopsy is performed and definitive treatment is done. Right now it can be months. It can be up to 4 months by the time a patient sees the medical oncologist.
I had just had my 2 tumors biopsied, and the pathology came back positive on both. So I knew the next step was to start chemotherapy, and which led me to go up to the Martin O'Neill Cancer Center. So I met with Dr. Smith, and he gave me my care plan, the chemo plan, and told me that I would, have to go in for a double mastectomy after we finished the chemo rounds. I needed to have a specific breast reconstructive surgeon. I wanted someone that basically reconstructed breasts for a living and didn't give facelifts and didn't do other cosmetic surgeries. So I went to UCSF.
I've had several patients, for example, who have had to go down to UCSF for special types of procedures that weren't offered here. A lot of patients who've had to go down to Queen of the Valley for various procedures. And the ability to offer all of those service levels here at St. Helena Napa Valley is going to be, I think, a huge advantage to the Napa Valley overall.
After talking with Phil, we decided that a second opinion would be in line. At the time that I needed to get the second opinion, there was not an opportunity at St. Helena Hospital, so I had to go out of the area and out of network. In my situation, upon having a second ultrasound with the updated, newest equipment, it was found that this was just a fluke, and it happened, and it was nothing to be concerned about. It was a huge relief for me.
after the biopsy, it was cancerous. However, it was not invasive. It was small, about the size of a sunflower seed, and it was removed, and I did need to have radiation. Because our cancer center wasn't finished, I chose to go to Marin, went every day for radiation therapy for 5 weeks. It was so wonderful having their comprehensive breast center and having a nurse navigator who saw me through every step of the way, checked in with me, made sure things were going well, and always reassuring.
We can't strip the system of the way that it runs right now and make it work the way we want it to. Even if you are somebody that runs an organization or an operation, that's not your option in this case, right? So you are sort of beholden to those persons who are in this industry. And the idea that somebody will be there for you immediately is I think, exceptional.
Having a resource, all of the resources under one roof, I think can bring these women together, as opposed to seeing all your separate doctors, here and there. It might be an hour and a half away. I would have been up there the whole entire time for all of my therapy if it was, existed. So
it's what we need to complete our wonderful cancer center. Rick and Elaine and their vision and energy have gotten engaged, and I'm so thankful they have partnered with us to bring this vision to reality. Tonight, we have the opportunity to make a difference for all the women in our community and our lives. We are all impacted by this, and together we can make this a reality tonight. Thank you so much for your support.